Good afternoon, everybody. Thank you all for joining us. My name's Simon. I'm from Radar Healthcare. As I walked towards the arena this morning, it took me back to 2011 when I first came into Excel at the first ever Health Plus Care show. And I'd booked the stand really late. So we were given the worst possible place right over there in the far corner, towards the back. And I remember walking through almost 10, 12 years ago, there was a smattering, there was 2 or 3 different tech providers that were in the hall. And when you compare that to how many technology providers that are around in both the healthcare and social care halls today, it's enormously different. The landscape is completely different to what it used to be 10 odd years ago. So the power of technology within health and social care has greatly improved. It's greatly improved for the people that we take care of. It's improved the quality that we deliver. It's improved the efficiency for our staff members. But alongside that comes other challenges and other perhaps problems that we have to encounter. And that is which system to buy, what is the most useful system for our environment, and then what systems speak together that are going to make our environment safer, better quality, more efficient. And that's one of the greater challenges for lots of different organizations, because technology in health and social care used to be the domain of the big groups, but that's no longer the case. Even small operators can now receive real tangible benefits of using good quality technology for all the reasons that I've already said. So my name's Simon Quazier. I'm the Chief Revenue Officer for Radar Healthcare. And those of you that aren't familiar with Radar, we're an incident reporting, governance, risk management platform that marries lots of different processes that occur in a health and social care setting into one cohesive system. And we underpin all of that through analytic dashboards that give us data visualization. So that's what Radar does. I'm delighted today that Nuno accepted our invitation to come and speak with us at this show. Nuno is the CEO of Nourish, the visionary of the company, and he's got a particular vision and a culture within their organization that really lends itself to what we're trying to achieve at Radar too. Nuno, would you like to introduce yourself?
Thank you, Simon. Am I on? Can you hear me okay? What can I say? I resonate a lot with this arc of, my first show was probably 2014. There was a sense that all the technology that existed was trying to address really narrow problems within a care provider. So I call them widgets. There was technologies coming into the sector and solving some little problem, which often, seen from the point of view of care providers and care teams, actually had more work than benefits. So there was resistance to technology. Now, I developed the entire hypothesis for Nourish on the basis of, first, be really clear about what sort of impact you want to deliver. In our case, better life for everyone. That means focus on the individual, drawing on the care from the care workers that use our product, and be really clear about the set of values that you use to drive the growth of your business, the growth of impact. Now, I have to say, agree with Simon, there is now a landscape where there's probably way over 100 providers of technology actively selling into care providers, and it became really noisy. So I think that part of the work that we have, companies that are widely used, is to actually help care providers navigate the landscape and help care providers with identifying what good looks like in terms of adopting not just technology solutions, but technology frameworks that allow care providers to become more agile, that allow care providers to have choice and to navigate the options that are given by all this technology that now exists around us, keeping a very clear focus on impact on quality of life for the people receiving care. Now, I met Paul Johnson probably a good 6 or 7 years ago, and I have to say the reason why Radar and Nourish have now been integrated for a good 6 months in terms of development and so on. The main reason why we got this far is that we have shared values. And I still hold to this day that the values of the partners we choose to work with need to resonate with ours in order to enable us to deliver that impact at the end of the day. So that's where we're coming from, and I don't want to steal the show. So Simon, over to you.
So when we set out this relationship, there was a very clear line between what we provide as far as incident reporting and governance of that. But then let's talk about what happens from a care worker's perspective. The logical place to report an incident when it's about one of the people that we support, whether it's a resident or patient, whatever you call the people that you support, is in the care planning software. There's a huge drive right now across the country to move towards this digital landscape. In fact, I've heard that even the government are willing to support some of that effort, right? So the idea of a care worker coming along with a handheld device and looking at a care plan, looking at the care delivery, entering in that Betty's had a fall in the corridor, the natural place to do that would be in the care planning software, correct? Now, once you've reported that incident will be automatically fed through into Radar, and that incident type will be managed through Radar's workflow. And that workflow can be customized to whatever you want it to be. So if it's a meds error, if it's a fall, it goes one direction. If it's a meds error, it takes a different direction. The way that Radar works, it's role-based, so that if an incident has happened and a certain individual needs to be reported to and notified, that's what you can do in Radar. Now, hopefully, that provides a far more efficient use of people's time. You're acting upon the issue at hand and you're expediently making sure that it's dealt with. Then we close the loop. That incident, once it's closed down, goes back into Nourish, and that incident is closed. Our vision for this is that not only does it close the loop faster, but it makes sure that actions are being dealt with in a more timely and efficient manner, and that hopefully what the end result will be the ability to learn that why are these incidents occurring. We recognize that we're not going to eliminate all incidents, full stop, in healthcare settings. But what we can do in this process is learn what is the trend that's occurring. Why are you receiving so many falls? Is there some correlation between a staff member? Is there correlation between the environment? There's lots of things with the after action review that you can do that will give you that trend analysis. And that's something that both Nourish and Radar feel very strongly with. So in terms of having now a more cohesive system between Nourish and Radar, not only does it represent a hopefully better safety, but also I think what it does, it opens up some further opportunities. And we wanted just to give a brief look at how this looks and what does this look like? How does it manifest in reality? And we'll just let the video catch up to hopefully explain this. So whilst this is catching up, the incident form that is reported to in Nourish will then create the same event type in Radar. And then the other ability that we'll then have is, we've got so this is a Nourish form. And if you just guide us through this one, Nuno.
I mean, it's the system that hopefully some of you know, and within Nourish, you can not just manage the care for everyone within the cohort of a care home or a care team that you support, but you can, from any screen within Nourish, you can report an incident, and that's what we're going to see in a moment. So, as a care worker right now, I am saying that I want to report an incident. In this case, yes, we have a Radar healthcare incident. You can report other types of incidents. But once you report the incident within Nourish, that information flows immediately into Radar. Now, I'm going to do a bit of talk over. The reality is the combination of Nourish and Radar enables you to have a first-in-class care planning, focus on each individual receiving care, completely personalized to each individual, at the same time that you have a continuous improvement engine, which you have in radar. So the person is recording a slip, trip and fall. Filled in the date, filled in the description of the incident. It's a bit slow.
It's a bit slow.
But what you can see here is that there is an incident report where all the data about the incident is actually originated and kept within Nourish. So within Nourish, you have complete coherence of information of what incidents happened and what is their current status within Nourish. So when the status changes within Radar, you actually get an update within Nourish of what is the current status of this incident. As a care team, what this means is that you don't have to hop between systems all the time, right? I guess it's nearly over to you now.
So while this then feeds back into Radar, we've already described what that workflow looks like. Shall we perhaps talk to the audience about where do we see this going from here? Because that might be also interesting. But what this is now going to convert across into Radar. Where do you see our partnership growing? Where do you see the ability to further expand on what we've already created from the initial integration?
I mean, I feel that what we're doing right now is extremely exciting. So Nourish is providing a digital framework to very small and very large care providers across the UK. All those providers can take advantage of the combination between continuous improvement framework that is offered by Radar, all the audits, all the incident management, all the compliance and workflows associated to that. Now, what we are seeing is an emergence of thinking around integrated care systems that didn't exist before. And increasingly, we are seeing CQC having to look at systems, i.e. CQC doesn't look just at care providers anymore. Going forward, we expect CQC to start looking at regions and looking at communities. I think that is exactly what I see as working and making a huge difference, is looking at an entire region, looking at outcomes for people, which is ultimately what Nourish is here to try and improve, outcomes for people at the same time that across the entire system, whether it's the commissioning body, the ICS, the local authority, the care provider, or primary care, there is a continuous improvement movement that is enabled by Radar. The combination between the two systems for enabling a learning culture across ICSs is extremely powerful. And I think that when that is probably the excitement that keeps us going, is that there is a lot of work to do on that front. And the door is open. I feel that the system has opened the door for us.
Yeah, there's lots of information that currently that we're just talking about incidents. But in Nourish, for example, you record the weight of a resident, the nutrition, the hydration. There's lots of different parameters that are recorded within the care plan that can be fed through into Radar. And in Radar, through its analytics, we can create pulses so that the right individuals get notified. If a resident's weight drops by X, that somebody gets notified. This is a really smart way of using the data between our two companies. So that's one simple idea. There are other things that we're now exploring alongside that, because this is about putting data together and making sure that people have a really first-hand view of what their business and their care operation is looking like. And I think, touching on the point that Nuno has already made about the ICSs, we know that there is a real drive to hopefully put health and social care closer together. It's called the ICSs, right? And our vision is that what we're managing on a local level through one group, we could actually manage on a much more system-led approach. And the exciting thing that we talked about last night was that your vision and our vision in terms of where we could take this, and this is a map that we'll just leave on screen to describe, but that gives a real holistic view as to how maybe even relatives and the friends of the people that they could support could start getting that same view of. Talk to us a little bit about this further, if you can, Nuno.
Yeah, so again, we think about improving outcomes for people regardless of where they are on the journey. It can be that they are self-managing at home with a couple of visits a week, or they're living in a care home or a nursing home with 50 interactions a day. We can see how care teams trained and resourced in the right way with the right processes can improve quality of life for people. What needs to happen alongside that is a system that learns, a system that from every incident is able to take learnings and is able to map that into improvement and drive improvement across the system. We will not be able to do this with the paradigm that we have right now of everyone managing incidents within their silos and everyone managing outcomes within their silos. So where we start getting quite a lot of movement is when we start having conversations with ICSs that see the landscape of social care and healthcare as it's basically an augmentation of public health. Each one of us ultimately could be receiving background support of this nature, but ultimately we're looking at people that are older, live with frailties or disabilities that can have much better outcomes if they are themselves engaged with systems. Nourish is increasingly, and I would like to think that we are leading the way on having people using digital platforms to make their own choices, enable people to make choice and drive their own trajectory through the care system. But also we need to make sure that there is a good continuous improvement, continuous learning system that we are joined at the hip with, and that is basically what we're trying to build with Radar right now.
We for some time now, some of you are Radar users, so you'll be familiar. In Radar, you build a form, and in that form can take the text of either a drop-down list of options or a free text box. And within that free text box, and the same in Nourish, Radar has the ability, using machine learning and AI, to create sentiment analysis. There are simple words that people type into an incident form or an audit, which allows you to understand. It might be around leadership, for example. Now, leadership on its own, if you take that word, you think that might be a positive. But what we're finding is that by pulling out these reports around sentiment analysis gives you the opportunity to see actually there is more going on, the human factors. Why are people writing about leadership? Do they need more leadership? Is there something wrong with the leadership? So the ability in the past would have been to look at a form, to sit down with somebody, have that conversation to really learn. Now, with Radar's AI technology, it means that we'll be able to present that data back to you in a much more meaningful fashion, which wasn't available in the past. And I think the exciting thing from our partnership is that they've got very similar ideals, and you've got similar forms in Nourish that we could provide this together, and we may be able to create something that is really revolutionary. And when we sit together with Nourish team and the Radar team, in fact, our technical guys were there this morning discussing some of this, there is lots and lots of possibility that will then feed back into this map, which is why we wanted to present this concept to you today. So I think, shall we end it there, unless there's any other points that anybody
I
wishes
wanted to
to make?
say thank you, Simon.
Yeah,
Thanks
thank you,
to
Nuno,
Radar for
for
inviting us.
participating.
Okay.
If anybody wants any further information, either visit Nuno and his team on the Nourish stand, or equally, Radar's right next door, and help yourself to a free coffee. We'll leave it there. Thank you.
Thank you.